Okay, let's talk about one of the toughest scenarios you're going to face in your exam, duty of candor.
Welcome to this clinical walkthrough on the duty of candor case for UKMLA, brought to you by Mediate, your 24/7 practice partner. We're tackling a real classic exam scenario today, how to handle a missed fracture. All right, let's get into it. We're going to break this consultation down into 6 really clear stages. Think of this structure as your roadmap, your lifeline, for when you're in the exam.
First up, the setup. Those first few moments are absolutely crucial. You have to create a sense of calm and control right away. It's not just about looking professional. You're building a foundation of trust before you have to drop some pretty difficult news. So look at this wording here. It's direct, it's calm, and it immediately signals that this isn't just a routine chat. When you use phrases like something important and go through everything carefully, you're preparing the parent, you're giving them a heads up without sending them into a panic.
Okay, on to the next step, and this one is so important. Before you say anything about the error, you have to assess the patient. Why? Because it shows that your #1 priority is their kid's well-being, not some administrative mistake. It's all about patient first, always. This question, it's non-negotiable. It has to be the very first thing you ask. It instantly puts the focus back on the child's health right now, and it shows the examiner you get what your duty of care is all about. And then, you'll want to run through a quick little checklist. Are they in pain? Can they move the limb? You're asking these things to quickly rule out any serious complications, like a displaced fracture. It just shows the examiner you're thinking on your feet, like a good clinician.
So once you've checked on the child, you need to find out what the parent already knows. Just ask them what they remember from the last visit. This gives you a baseline, right? You have to know what story you're correcting before you start talking.
Okay, here comes the hardest part. Actually disclosing the error. Your approach here has to be super calm, factual, and empathetic. Let's be honest, this is where the examiners are really watching you.
A great technique here is to use a warning shot. Don't just jump into the bad news. A phrase like, "There's been a development regarding the X-ray," gives the parent a moment to brace themselves. It softens the landing a bit.
So, how do you explain what happened? Just lay out the facts step by step. You're not making excuses here. Not at all. You're just being transparent about the hospital's process. It shows you respect them and their right to know exactly what went on.
And this is the key statement. You deliver the news, you give a direct, sincere apology, and you immediately show you understand how they must be feeling. Using phrases like, "I'm so sorry," and "I understand how concerning that must be," are absolutely essential. All right, once the news is out, you have to be ready for the reaction. And please, don't rush this part. Let them react. This is a test of how you handle pressure while staying calm and empathetic.
Here's a simple 3-step tool you can use. First, acknowledge. I can see this is frustrating. Then, validate. Anyone in your shoes would be upset. And finally, empathize with a genuine apology. It's a fantastic framework that gives your empathy some structure. You can practice this exact case right now and get objective feedback on mymediate.com. Okay, so after you've managed that initial emotional reaction, it's time to pivot. You need to shift the conversation toward a clear plan of action. This is how you show you're in control and start giving them some real reassurance. Now, you have to think like the parent. What's their biggest fear right now? Long-term damage, right? You need to address this head on, even before they ask. It shows you get it, that you understand what's really worrying them. And here's how you do it. Stick to clear, simple facts. Explain that hairline fractures are small. Tell them that complications are not common at all, and remind them that kids' bones heal incredibly well. These facts are your best tool for reassurance. Next, you lay out the clinical plan. A simple, clear, 4-step plan shows them you have a path forward. It's all about moving the focus from what went wrong to how we're going to make it right. And don't forget to explain the hospital protocol. Tell them there will be a formal review. Mention that senior doctors are involved, and let them know about the Patient Advice and Liaison Service, PALS. This shows that the entire hospital takes this seriously and is accountable. All right, we're almost at the end. It's time to close the consultation professionally. This is all about answering their last questions and really reinforcing that you're committed to their son's care. So what if they ask, how could this even happen? You give a balanced answer. You have to acknowledge the failure, that the fracture was missed at first, but you also explain the safeguard that the double-check system is what caught it. It's about being honest without getting defensive. And here's your closing line. Bring it all back to the child. Reassure them that from this moment on, their son will get the absolute best care.
Then and only then, you open it up for any final questions. It's a strong, responsible finish.
You can practice this exact case now on mymediate.com.